A diagnosis of breast cancer at the age of 32 was a big shock for Natasha Eaton, who initially thought it would mean she wouldn't be able to have children. Natasha was a participant on the POEMS clinical trial, which was a breakthrough study for women with breast cancer and was aimed at preserving a woman's fertility during their cancer treatment.
I was 32 when I was diagnosed. I found out one night when I was on the phone laying in bed. I just touched my breast and found a lump. Freaked out and went over to my aunt's place, and she calmed me down and told me that it's not to worry, it's not going to be anything bad, and it's just going to be a cyst. It ended up being breast cancer. There was no history that I knew, but my mum did have and died of ovarian cancer. So I'd just been checking my ovaries. To me, there was no link between breast cancer and ovarian cancer. I was 32. I didn't have any children, and I wanted to be a mum. Yeah, it was really unfair. My aunt was and it still is my rock. She gets me through it, and we've always been close. So yeah, I went and met Fran that afternoon. She put all the whole of what was happening into perspective, calmed me down because I was very upset about, starting chemotherapy too soon for me. Then she suggested that I have the operation first rather than try and shrink the tumour. Fran told me that when she mentioned, we spoke about chemotherapy, she said there is a chance that this could do something to your ovaries and they're not going to be able to work again. Which I, as a woman, seen my mum go through ovarian cancer, knew that, there was going to be a strong possibility that's what was going to happen. I wasn't going to be able to have children. Save my life, but take away me becoming a mum. Fran said, we have a clinical trial that's about to start, and you can be part of it. Yeah, you're young and, you want to become a mum. Poems was about protecting, or that was the idea, to protect my ovaries from chemotherapy. It was a no-brainer. I knew that I wanted to be part of it and give it my best shot of becoming a mum, and I was ready to do whatever it took. To be part of the clinical trial, I had to have injections a couple of days before I started chemotherapy. So every chemotherapy I had to have the injections, and so I had 6 rounds of chemotherapy and I had 6 injections of the drug. I was going to see Fran every 3 weeks at that stage, so she was keeping a good eye on me to see how I was going. And yeah, what I remember of what she explained to me was that it was an injection I would have. The drug would then put my ovaries to sleep and protect it from the chemotherapy. The idea was that the drug would put your ovaries to sleep and then they would wake back up essentially, and you would get your periods again and hopefully start releasing eggs, and like it never even happened. After I finished my treatment, Fran said that 2 years and then you can try to have a baby. That's a good time frame after having treatment, get you back to good health. I didn't even think when I started throwing up that there was anything wrong. And then I was throwing up every morning. So I think I must have been, about 8 weeks. But 8 weeks of throwing up every morning. And it was like, ended up saying something to my aunt, and she goes, maybe you're pregnant. I went, don't be ridiculous. How? My ovaries were still asleep last time I had my ultrasound done. I did the test, and initially that first thought was like, no, I'm not. Don't be ridiculous. Like, how? I haven't even had a period. Like, can't be right. And then the fear set in as like, oh my goodness, I might not even be able to have this baby. I was worried that there was going to be something wrong with the baby, that it was too soon from treatment. And that just scared me, because I thought, maybe what happens if this was my only child that I was ever I wasn't going to be able to fall pregnant again. I was very over the top as far as checking to make sure that he was okay, and I had a scan at 28 weeks and he was small, on the small side. So then I had another scan at 30 weeks and he hadn't grown. So I was like, that's not right. So I rung my obstetrician. He said, just go up to the John Hunter and get them to check you over. Anyway, my blood pressure was up. So then I spent the next 3 weeks in hospital. I ended up getting preeclampsia. So I was right in the fact that if I didn't do anything, something could have happened to him if I didn't do anything. Then he was 5 weeks early and then he spent a week in NICU. I would tell any woman that was about to have chemotherapy, if there's a clinical trial, get involved with it, because you don't know. It let me become a mum, and that was one of the most important things to me. So if you are passionate about something, you just got to do it. He only just found out this week that I even had cancer, because it's not something that I talk about now, because it's been 9 years now. Like for the first 5 years, it's just like it becomes your life because you're petrified of reoccurrence. But I've let it go now. And I said, Mummy's had cancer. And he was like, have you really? Because he knows that I've got my breasts aren't there anymore. I haven't actually sat him down and said, this is what happened. But now that I've spoken to him, now that he knows that I've actually had cancer, that I'll sit him down, and at the moment it's sort of like, whatever, Mum. Yeah, it was just a roller coaster of a ride. I've been lucky in the fact that Fran has been so supportive. It's only since I've had my breasts removed that I haven't seen her every 6 months. I could ring her up now and make an appointment as soon as I could, and she would see me. She's such a wonderful doctor and person that she's just on the pulse. She never leaves anyone behind, you know what I mean? Just because, I've got to this stage, I've been weaned off her, so to speak. You put your life into her hands, and it's just hard to explain that her decisions control what happens. Sometimes I think about it and it's just like, can't believe it. But then I look at it that I'm meant to be still here. I'm meant to have had my boy, and everything has worked out the way it was meant to work out. At the time, Mum was the only one that had the ovarian cancer, and she had 6 female cousins that had breast cancer. But I didn't know that when I had it. So I had that, and then they chucked a genealogist or whatever they're called in as well, and I was going to those appointments, and I seriously didn't think that I was going to have the gene, even though statistically it was all there that it was going to come back that I was going to have it. My aunt got tested, obviously, with her sister dying of ovarian cancer and me with the breast cancer. So she got tested. She's come back clear. Yeah, but I'm so glad I did now, because there's so much more that they can do for me, knowing that you do have the BRCA gene. And then since my diagnosis, and since being told that there's the BRCA gene in the family, 2 more cousins have got ovarian cancer, and one has died, and one's now fighting for her life. My aim is to always live the life my mum never got to when I found out. And it was a really difficult time, because she was the first one in our family to have cancer. They've definitely come a long way with treatment from 1999 to 2008. So the upside of this clinical trial 10 years on is that it is available for all women going through any type of cancer. I was the first one to get pregnant. I know that much.
That was Natasha Eaton, a clinical trial participant on the POEMS clinical trial. To find out more about breast cancer trials and our research, go to breastcancertrials.org.au.